How to do a
Hi
fine
guys,
needle
so in this video I'm going to
aspiration.
show you how to do something called a fine needle aspiration. We usually do this, for example, if there's a mass that we can feel, maybe if it's in the breast or anywhere in the body, and we want to see whether there is cancer or not, or any certain growth or anything, we can do a fine needle aspiration. So, okay, that's the needle. That is just the gauze. So you want to make sure that you have all the equipment before the time. You're gonna have two slides for this final. Slide one is and here you must write down fix with the patient's details. Fix is we're gonna put the spray on. Slide two is gonna be the clear one. So there I'm not gonna spray anything, and that's just example like that you're gonna have to use the spray. For the slide that you're going to spray. So I'm just showing you there, you need to just wash your hands. You're going to have to put on gloves. So I'm not using gloves in this procedure, but you need to use the protective equipment. That's very essential. Okay, and then obviously what you do, you take your gauze, you put some alcohol on, and you clean the area. So that's just an example of like an area that I'm just cleaning, right? So you clean the area, then you have your syringe. So you take your syringe, maybe 3 ml or 5 ml, you put your needle on the syringe. Okay, right? Make sure the cap is on. Okay, take the cap off. Okay, you can say I use a black needle. Don't pull back yet. You first put it into where you feel the lump is. You go into the lump. Okay, so you go into the lump, you go in, then you pull back on the needle. Okay, then you need to go back and forth into the lump, because remember, you want as much cells, you want to get as much cells in the lump as possible. So that vacuum that you create, right? Don't release the vacuum. Keep it there, and you try to go in all directions. You can see there I go in all my directions. Okay, you go in and out, you go out and change, go in again. Okay, now I'm done. Now I take it out. Don't release yet. Do not release yet. If you release, there's going to be a plunger that goes out. Okay, in real life it will go out. I just have to demonstrate that that air will go back down. Take off your needle, then you pull back on your syringe. Then you reinsert that same needle, because that cells is actually the inside the needle. Then you release all of that air through the needle into slide one. Then you smear slide one with slide two. So you smear it nicely together. There we go. Okay. You smear it nicely so that the cells can go onto slide two as well. Then you can see the arrow to fix. That's where you're gonna spray. So the one with the fix, you're gonna spray that fixative on. Okay, about 30 centimeters, basically the length of a ruler. You spray, and that will be the fixed one. Then you clean the area. You just spray. Obviously, it's gonna bleed a little bit, and then